Good afternoon, everyone. This is Javier Sandoval signing in from SpectraCell Laboratories in Houston, Texas, and I'd like to thank you for taking time out of your busy schedule to join us for this month's webinar series on micronutrient testing, which is one of several tests that we provide here at SpectraCell, and there's no one better to be able to provide this presentation to you. He's been with SpectraCell for many, many years. Dr. Jonathan Stein is the scientific consultant and the consulting laboratory director for us. He's been in healthcare over 15 years, and his areas of expertise include diagnostic testing, nutrition, longevity, cancer, clinical genetics, and genomics. He's board certified in high complexity as a laboratory director, and he's also, fun fact, he's also a certified yoga instructor. So sit back, relax, enjoy the presentation. We feel that it's going to provide you with a lot of information that you will need to be able to better assist your patients in helping them improve their health and longevity, and they see you as that expert that is able to find a test that is extremely unique in the marketplace, because SpectraCell's been around for well over 30 years and we have the best micronutrient test on the market. So with that being said, I'll turn it over to Dr. Stein at this time. Enjoy.
All righty. So I hope you can see my slide now. I am Dr. Jonathan Stein, the scientific consultant for SpectraCell Laboratories, and I am delighted to go over the flagship offering, our micronutrient test, the basics of what you need to know, and some answers to some common questions we get that I hope will be helpful for you. So without further ado, let's jump right in. Who we are and what we do. So SpectraCell Laboratories is a leading provider of advanced clinical testing services. We're based in Houston, Texas, and we provide a number of clinical diagnostic tests for various healthcare solutions. Some of those tests include micronutrient testing, which will be our topic for today, but we also do cardiovascular risk analysis, some genetic testing related to longevity and methylation, and others. So the testing provides valuable insights into a patient's unique nutritional status, their metabolic function, some of their genetic predispositions, and they allow for targeted interventions and personalized treatment. The mission here is to transform healthcare through personalized diagnostics and innovative testing solutions, and we are dedicated to improving patient outcome and quality of life by providing accurate, actionable, and personalized information that guides healthcare decisions. So that's sort of the 20,000-foot view, and let's go into some of the particulars. It started with a laboratory in Austin. There was a PhD named Bill Shives, who was fairly well known for discovering some of the vitamin Bs. He worked with Roger Williams on looking at biochemical individuality, and it was one of the sort of first kind of views to look at nutrition from a personalized medicine lens. This happened, it was patented in the early 90s, and there are still no labs doing exactly what we do. It required living cells rather than just blood to measure cell function. I'll get into the importance of that later. But the SpectraCell micronutrient test has been around for 30 years, and they've performed over 1 million tests now. So it's a very, very well-established science at this point. Our approach is different from a pharmaceutical approach. So with nutritional repletion, you're essentially optimizing the body's biochemical metabolic pathways. As long as you're managing dosage correctly, there's minimal side effects, if any, and it's curative. And the goal here is to have a balanced system. This is very different from pharmaceutical approaches, which alter metabolic pathways and can have side effects, and also alleviate symptoms, but may not address the underlying cause. So nutritional repletion is a completely different paradigm. And in many ways and for many applications can be very superior in that it can address the underlying causes. The SpectraCell test, there's lots of ways to think about it. I have been asked many, many times to keep it as simple as possible. So sort of the easiest way to put it is it's a blood test that tells you the nutrients that you are deficient for. The way it does that can get more and more and more complicated and particular. but let me kind of riff on it. We grow the patient's lymphocytes under a variety of different nutritional conditions, and we try to identify the nutritional supplements that result in an improvement in lymphocyte function. So we are looking for significant improvements in your immune system's ability to grow and divide. And we do this test in triplicate for 34 different analytes that I'll go into in a few slides. It's a functional assay in that it measures the ability of the cells to grow and divide. We're not counting molecules floating around in serum. And that can be very important at the level of biochemical individuality, in just the same way that taking the RDA for everybody may not be appropriate for them because of their particular underlying genetics and biochemistry and a lot of other things we're going to go into. The best example I can give for this is there's a vitamin D receptor polymorphism. It affects about 1 in 6 individuals of European descent, and it impacts the ability of their cells to absorb vitamin D. Everything that vitamin D does, it does inside the cells. So if a person has trouble getting it in their system, their serum levels may seem higher or normal because it's not getting in where it needs to be used. But a functional test, an intracellular test that looks at what's going on inside those cells can tell you whether or not it's being utilized properly or whether there's an issue of deficiency. The SpectraCell micronutrient test includes a large number of different analytes, 13 different vitamins, 6 different minerals, a number of antioxidants, amino acids, metabolites, and fatty acids. Every micronutrient test attests these 31 nutrients and 4 metabolic tests that are a little bit different. The Immunidex, which is a test for cell-mediated immune function, and essentially the ability of your immune system cells, your T lymphocytes, to grow and divide. Spectrox, which is a functional test for antioxidant function. Essentially, the cells are challenged with are exposed to an oxidative challenge, and we measure the ability of those cells to survive and grow and divide out of that. The glucose-insulin interaction and fructose sensitivity test, which are tests for carbohydrate metabolism. Very similar, the cells are challenged with different carbohydrates, and the ability of the cells to tolerate those challenges is assayed. These tests don't exist commercially anywhere but at SpectraCell laboratories. So the Immunidex is the first step in every micronutrient test, and people who are new will often say, well, what is the Immunidex? It's the control. So essentially the cells are stimulated to grow and divide in a optimized media that has everything the cells need to grow and thrive and divide and be happy. And we measure how well they do. Now, patients that have many deficiencies may end up having relatively low ability of their immune system to grow and divide. People who are immunocompromised may have an issue. People on chemotherapeutic agents. And so this test will identify that. More is better. The proliferative capacity of your lymphocytes is a well-established marker of immune function in the medical literature. In fact, the SpectraCell is based on what's called a lymphocyte proliferation assay, which has been around at least since the 80s, maybe a little bit earlier than that. There's over 75,000 studies of lymphocyte response and over 250,000 studies looking at immune response. It is highly correlated to immune health, and the health of your immune system is your health. Your ability of your body to handle pathogens and inflammatory issues is extremely important to your overall health. The Immunidex is different than immunity. Immunity is sort of the presence of antibodies made by B cells. The immune function is your ability of your immune system to respond via T cells, which is what we are using for the micronutrient assay. We use a T cell specific mitogen compound that stimulates those cells to grow and divide. And so it is the T cell response to nutrients and to antioxidants that we're measuring at the end. An efficient adaptable immune response means better protection against pathogens, against external threats, better protection against malignancies, internal threats, and there are many studies in support of this. Strong immunodex means your lymphocytes are adaptable, which means you will have improved health responses. Again, this is very well established in the literature. We try to keep them simple, the reports as simple as possible. Nutrients are reported as green for normal, yellow for borderline, red for deficient. For SpectraCell and immunodex, it's strong, average, and deficient. The cutoff values and these determinations, boy, the last time I did it, they were based on about 40,000 patients. So a pretty good representative population for our patient population. Results are also quantified for those who want more specific data, and they are reported, we'll go into this quite a bit, as percentages. Now, we've normalized the data so that low is always bad and high is always good. Again, to keep it relatively straightforward in terms of observation and interpretation. So here's a simple sample report. So the results are given in a percentage because it's a comparison of growth rates. As I said previously, we have that optimized media, and then we have our test media, and we're just comparing how well did the cells grow when they were challenged versus how well they grew when they had a chemically complete media. So you can imagine a patient's cells being grown in the presence or absence of vitamin B12, say, and there's our test. The presence of B12, that's that chemically optimized media. The absence of B12, that's our test media, and we're simply reporting it as a percentage. Right? Actual cell growth based on the analyte compared to the optimal cell growth in that nutritionally perfect environment. We get a percentage. This is very different from testing the number of B12 molecules that are floating around in serum. And if you've got genetic variants in your methylcobalamin or anything in the B12 metabolic pathway, those numbers of molecules doesn't tell you how they're being used. These testing take into account absorption at the gut level, and then at the cellular uptake, and then the ability of the body to either store those cells or utilize those cells for growth. And that is, again, very different from counting molecules floating around in your system. And we'll talk more about that in a bit. So again, routine labs and non-functional testing will report the units in usually mass per volume, right? Numbers per microliter, micrograms per ml, nanomoles per ml. And we are, again, everything we do is a percentage of growth. So in terms of what you do with the results, we provide both nutritional sources and dietary resources and supplemental recommendations based on our nutritional consultants, so that there are many options and many ways to get things right back on track. So there are individuals available to provide consultations for the testing and to provide tailored recommendation. And we also provide an overview of recommendations. Ours are safe. They're different from, as a testing laboratory, we may not be able to provide clinical repletion amounts, but we will provide ones that through our nutritional consultants are safe. It's worth saying that nutritional repletion is very different from pharmacological interventions. The effects take time. Usually patients will start feeling really significant difference in the course of about 10 to 12 weeks. Again, it sort of depends on the nutrient involved in the clinical presentations. It works with your body. It enables and activates healing pathways. It's very rare to see side effects from a nutritional supplementation approach, particularly if you're moderate in that strategy. More is not necessarily better. There are some nutrients for which there can be excess adverse effects if you take too much. Most of the minerals, there can be toxic effects if you take too much of them. So it's important to use your clinical recommendations. the recommendations of your clinician. And too much of a nutrient can cause imbalances, particularly for antioxidants. A, C, E, and selenium all interact in complex ways, and taking too much of one and not supporting the others can result in pro-oxidant activity. So again, you want to avoid toxicity and nutrient reactions. So targeted supplementation is the absolute way to go, which is what we provide. So here's a question. If you eat a balanced diet, take a multivitamin, how can you be deficient? And the answer here is that there's, due to biochemical individuality, you may not be processing the nutrients you're taking on some level. Again, if you've got genetic variants in your biochemical pathways, you can get sort of accumulation. There's a huge difference between gross and subclinical deficiencies, so that's a thing. We are trying to identify these deficiencies, hopefully before you have symptoms, and get you in front of those. A balanced or a healthy diet is subjective, whereas the micronutrient test does identify specific deficiencies, and many more factors account for health. Even if you're taking the RDA, again, because you are an individual, I kind of say every body is different, and so your body is different. Your individualized biochemistry means that you may or may not be utilizing that as an average person would. You're not an average person, you're your own person. When it comes to supplements, one size does not fit all. There are many different formulations of calcium, for example, and some people can use some to great effect, and for others, they might have less than 5% bioavailability. So in some cases, even though someone's taking calcium supplements, they may not be absorbing them either at the gut level or the cellular level. And that's true for other analytes as well. Here are a lot of things that can impact your nutritional uptake. Your diet, the bioavailability, as we discussed previously, absorption at the gut or the cellular level, the ability of different proteins to transport these and actively transport them into cells or where they need to go, the ability of your cells to store them, variance in your nutrient receptors, your metabolism, hormone levels, genetics, disease and illness, excretion. Age certainly has an impact. Everyone here is probably familiar that pregnant women need more supplements because they are building new little bodies inside them. Gender is an issue. What supplements you do or don't take, your state of your inflammation. We kind of described autoimmunity as well. Many medications, statins in particular, that are quite commonly taken, can deplete the body of different nutrients. Your exercise levels. Gosh, there's a what do you call it? There's a profile I've seen for many years just called "What's the Diuretic?", where someone is deficient in multiple minerals. And are they heavy caffeine drinkers? Are they heavy soda drinkers? Are they marathon runners? All of those things can deplete the body of minerals that are needed. Smoking, alcohol, stress, all of these things can impact your individual need for nutrients. And so the SpectraCell test takes into account biochemical individuality. The next question, how do deficiencies affect patients? Here's just some of them. So some of the signs of hypoglycemia, mood, craving for sweets. Sometimes people get shaky when their blood sugar is low. Fatigue, headache, hunger. These are so common. Inability to focus. People who undergo surgery may have additional needs for even some of the rarer micronutrients. PMS, headaches, metabolic syndrome, insulin resistance, which can lead to diabetes. All of these things can impact deficiencies, and deficiencies can impact all of these things. So it's really important to get tested and to find out how what your body needs for optimization purposes. Again, this is very different from serum testing. Serum tests, serum is out extracellular, it happens outside the cells, and SpectraCell is intracellular. All the metabolic work of cells happen inside the cells. And absorption into the cell can be a big issue for many people. Again, many of the genetic variants that have been identified are common, quite common, and serum will not address this. When you're measuring someone's serum levels, you take a vitamin, have a meal, it floats around in your system for a day or two. Whatever isn't absorbed is excreted. Whereas studies of lymphocytes have shown that function changes very slowly over a long period of 4 to 6 months. Again, serum levels can fluctuate wildly, whereas tests of intracellular function tend to move much more slowly. And so these results take into account the last 4 to 6 months. If you think about what you ate this week, maybe you ate healthy sometimes, maybe you ate unhealthy some other times. Maybe you ate something that you don't eat very often. If you did a serum test after each one, let's say you, I had a housemate once who would run marathons some weekends, and some weekends he'd pig out on Ben and Jerry's. So imagine getting that serum test after the marathon weekend, or getting the serum test after the Ben and Jerry's weekend. And all of those things could make for wildly variant interpretations and wildly variant treatment. Whereas and sometimes you eat very healthy. So you can imagine what you want is, what is your nutritional status as a person who sometimes exercises, who sometimes pigs out, and who sometimes eats well? That's what you're shooting for, and that's what the SpectraCell test can measure. So we don't do home blood draws because the blood has to be obtained from a vein. We need about, I want to say about 10 ml of blood. So it's not conducive to finger prick testing. Whole blood is shipped overnight to SpectraCell, so it has to be collected. We're using live lymphocytes, so the blood must be processed within 24 hours of collection. For clinicians, don't centrifuge the samples, don't refrigerate them. That's not what we're looking for. The technology is very straightforward. The lymphocytes are isolated from whole blood, then they're introduced to what we call the 100% media, or the CFBI 1000 media, and the test conditions, and simulated to grow and incubated for 5 days. And then the cells are labeled with tritiated thymidine to distinguish new cells from original cells, and we see how well they are, and we count and we work out our percentages. So the argument for using T lymphocytes is very straightforward. Again, it's a long-term nutritional marker, which is we believe is a much more accurate picture of your nutritional use and needs. We can measure the functional capacity for growth. These cells contain nuclei. So unlike red blood cells, T cells have nucleuses, they have genetic material, and they are they share their genetic expression with most of the rest of the body. So they are a very good proxy marker for your overall health. It's a well-established marker. Immune cell health it's important, and it's a well-established marker of your systemic health. And it's easy to collect versus, say, biopsies or tissue collection. So live lymphocytes are the most appropriate cell for a functional assay, and so that's what we recommend, and that's what we use. What conditions benefit from micronutrient testing? Basically all of them. Nutrition impacts, it impacts wellness, and it impacts disease, and it impacts aging. We have certainly identified nutritional deficiencies in hard to diagnose patients with autoimmunity or pain. Some of the ones that sort of esoteric clinical presentation, fatigue, malaise, mental health, this can be due to many things, but they can also be due to nutrition. It's useful for overt system management, such as pain, headache, skin problems, symptomless issues, osteoporosis, hypertension, multiple pathologies, and also the deficiencies that can result from taking medication. So this test is very clinically relevant. It's a special test because the technology is both unique and mature. Again, it's clinically relevant because there are tens of thousands of papers describing the importance of nutrients to so many different conditions. We've only recently entered the direct-to-consumer market, but we're excited to be doing it. And again, it's typically ordered by physicians. So everything we cite boils down to 3 core messages. Nutritional deficiencies can lead to disease states. Functional testing is superior to static testing. And targeted repletion is the key to success here, as opposed to just sort of taking a random wheelbarrow full of supplements and hoping for the best. You are far better off doing targeted repletion. And SpectraCell micronutrient is the correct tool to get there. So let me finish up by saying there are many resources available. As we described, you can get clinical consultations. We have flyers, tech bulletins, webinars that are available, and a lot more. Thank you so much for your time. It's been a pleasure speaking with you today.
Dr. Stein, I appreciate it. That was a phenomenal presentation on MNT. We hopefully the viewers have found it beneficial and were able to take away, several nuggets from those that have been using our micronutrient testing, whether it's been for the last month or for the last 6 months or the last several years. For any of those that have chimed in from our efforts through social media and through online, we wanted to be able to allow you to participate in a webinar that was actually developed for our providers, but I felt that the information would be beneficial for those all involved. And so we appreciate your time, and to be able to kind of reward you for spending this day with us, there is a coupon that you can use. That is META, M-E-T-A for metabolism, but META 20. And so if you'll use that, if you're a provider, if you'll write that on your requisition forms when you're sending it in for your patients, that'll give you the discount off of your tiered pricing. And then for those of you that are going to be visiting our website, whenever you go through the order path and you get to that last section, you can enter in that coupon code of META20, M-E-T-A 20. Thank you very much, everyone. And this is Javier Sandoval from SpectraCell Laboratories in Houston, Texas, signing off. Y'all have a good day. Bye-bye.